watching. We have another episode of Cram and Jam. For our Cram today, we're going to be going over the GI system. And for our Jam today, there's going to be some, hopefully, Lilo and Stitch hula. Yes. And we were on a tropical paradise today. So come join us. Grab your pina coladas,
and
mimosas,
your study materials,
and we will have a grand old time. Yes. Okay. Well, have fun cramming and jamming with us.
Not bye.
Hi.
Okay, so we're gonna get started again because at this point in the broadcast we've already started.
Yeah.
So we're gonna talk about the major nutrients that you need as a person. The first one being carbohydrates. Chris, can you tell me what carbohydrates are? I know, I'm sorry.
They're your primary source of energy, and they have 4 calories per gram.
Excellent.
And they're 47% of your daily caloric needs.
So that's a lot. It's like pretty much 50. And they come in mono or disaccharides or polysaccharides, which are starches. There was some confusion on that. So starches, they are carbohydrates, but they're polysaccharides, so they're more complex carbohydrates. And then next there's fats, which are
Your
major
source of energy. They're 20 to 35% of your daily intake.
And they have 9 calories per gram, which is why butter is so bad for you.
Yes.
9 calories per gram. And then last, we have proteins, which are really important for tissue growth and repair and maintenance. It's important for bodily functions, energy production, and they also have 4 calories per gram. And they're 15 to 20% of your daily caloric needs. And they're made up of these little building blocks called amino acids. You have essential and non-essential amino acids. Essential amino acids are not produced by the body. Non-essential can be synergized by the body. Synergized is not the word I meant to use. I'm just thinking about synergy. And then, so you can have complete and incomplete proteins. None of that probably going to be on the final because it's frankly very specific. Then you also have some vitamins, like the decavitamins, which are
What are the vitamins, actually?
they're fat soluble.
Okay, fat soluble vitamins. ADK. A, D, E, and K.
I call them the decavitamins, D,
Oh.
K, and A.
That's why I didn't know what she was talking
Where the
about.
confusion comes from. I also told her I didn't think we needed to do that, and then I changed my mind.
So just ADK or DECA.
Whichever you prefer. And then you've got some major minerals, which you can probably guess a couple. Mike, would you like to guess a few?
Calcium,
Magnesium, chloride, phosphorus, sodium, and sulfur. I'm like, what is that? Oh, okay, sulfur. SU, I don't know that one.
That might not really be the chemical symbol for it.
I'm not sure. I think it could be just
I could have made that up.
I don't know. It's been a long time since chemistry.
Yeah.
And next I have cards on obesity because there was just really no logical jumping point from nutrition to anywhere else except for being overweight. So obesity, you have the
2 different types of weight distribution.
Yeah,
You have pear shape or gynoid.
that's the better kind to be.
Yeah.
You're gonna be a kind. This is
That means baby got back.
yes.
Yes. And there's the apple or android shape.
And so the gonoid shape, the pear shape, is associated with osteoporosis.
It's a big one.
Yep. And you have a weight to hip ratio of less than 0.8. The android one is associated with heart disease, diabetes mellitus, cancer, and this visceral fat, which is here in your tummy, is more active, causing increased triglycerides, decreased high-density lipoprotein cholesterol. I don't know why I said that all out. HDL.
Yeah.
And it doesn't even
all the metabolic.
all of the metabolic syndrome shit.
Yes.
Excuse me. It's associated with
Stuff
is associated with android obesity.
Yes.
And then we've got some stuff about BMI here. So that's your body mass index.
But it's just the formula.
It's just the formula. You're probably not going to need this, but if you're curious and don't want to Google it, weight in pounds over height in inches squared times
703.
703.
703.
Aren't you glad we don't need to know that? Because that would just be a baller to
Watch it be on the test and you will love me.
We're going to be like, I'm so glad we watched that. Metabolic syndrome. We were talking about it a minute ago.
It means your waist circumference. If you're a man, it's going to be greater than 40 inches. If you're a woman, it's going to be greater or equal to 35 inches. You have triglyceride levels greater than 150.
Or you're on a drug for your triglyceride levels, like a statin.
And HDL of
less than 40 in men or less than 50 in women.
Mm-hmm. Blood pressure. Or you're on a drug for
lowering them. Oh, okay.
Yeah.
I didn't write these cards, so I'm like, I'm not really sure what that arrow means.
I draw like hieroglyphics. And
my cards are like that too. We're just not using mine.
Your blood pressure would be greater than 130/85, or you're on a blood pressure medication. And your glucose level, fasting glucose would be greater than 100.
Yes.
Or
you're taking insulin or something.
Yeah.
Fasting, taking insulin, which would be weird. Next, now that we've gone over obesity, I have the pathophysiology of vomiting, which when I saw this card, I was like, well, I think everybody knows what vomiting is, but it's not really about what vomiting. It's about like what vomiting really is. It's not just like, okay, we know that. Your autonomic nervous system is activated, which stimulates the
sympathetic nervous system and your parasympathetic nervous system.
And so your sympathetic nervous system is going to cause you some tachycardia, tachypnea, and diaphoresis.
And your parasympathetic nervous system causes the relaxation of the lower esophageal sphincter. Yep. And it increases your gastric motility and salivation. And this is just right before you vomit. So all those like
throw up feelings.
Yeah, you can blame your parasympathetic nervous system. Gotta love it.
I always blame mine whenever anything goes wrong. Red lights. Damn it.
Parasympathetic nervous system. Yeah.
All right. And so the clinical manifestations of nausea and vomiting, if you couldn't guess, are nausea and vomiting. And you also don't have as much water, so you get dehydrated, and then you have electrolyte imbalances. So you can also get metabolic alkalosis, which can result from the loss of gastric hydrochloric acid.
Yes.
So that's going to make your body more basic because you've lost your acid.
Yeah.
Metabolic alkalosis, more alkaline.
Or you could get metabolic acidosis, which can result from the loss of bicarb.
That's if you have been vomiting the contents of your small intestine.
Yeah.
So you've lost your bicarb, which would have made you more basic. So now you're really acidic. Metabolic acidosis.
Mm-hmm.
And then we've got some drug therapy for nausea and vomiting.
There's a couple of
different classifications.
Right. You probably don't need to know the classifications. We'll just throw them out there real quick. There's antiemetics, which is like compazine. There's anti-muscarinic.
It's muscarinic. Because they're like this, it's muscarinic acid. It's in mushrooms.
Well,
so if you wanted to increase your gastric motility and thereby your metabolism, eat mushrooms.
And if you wanted to barf, eat mushrooms too. Okay, that would be scopolamine, which is what they give you if you're motion sick. Also,
didn't know that.
Patches behind your ear.
Oh,
yeah, that's what's in them. Antihistamines like phenergan.
Prokinetics that act on the dopamine receptors like Reglan, and serotonin antagonists like Zofran and Anzanone.
Everybody's favorite.
Now I have a card on parenteral nutrition, which would be nutrition that you don't eat with your mouth, that you get through an IV line or eating it intravenously. They usually don't do this in a peripheral IV, or at least not for very long. It's the administration of nutrients into the bloodstream. You can do dextrose and H2O or lactated ringers. Those are considered parenteral nutrition. They don't have any protein, and they're 170 calories a liter. If you do that for a couple of days, you will lose a lot of weight, because 170 calories a liter is actually not that much.
No. But if you just needed something to get you through a couple of days, that would probably be
the choice.
Yeah.
There's some stuff on here about fats and protein that is highly specific. You can get nausea, vomiting, and temperature if you infuse parenteral nutrition too quickly.
Just a random tidbit. The bags need to be covered with a covering because the
it's light sensitive, right?
Yes, it's light sensitive.
Mm-hmm.
So it can compromise
break down and compromise your solution.
Yes.
Also, your solution's only good for 24 hours, so it needs to be in
refrigerator.
It needs to be in refrigerator until 30 minutes before feeding.
Yes.
Yes.
And then it can hang for 24 hours.
And then you gotta take it down.
Yes.
So if there is a question that says, the bag has been hanging for 24 hours, but they've only got a little bit left, the answer is no, take it down.
Mm-hmm.
And also you can have tube feedings if the person is not eligible for parenteral nutrition. And so that would be through a tube into the stomach, duodenum, or jejunum.
Mm-hmm.
And you can start feeding through a PEG tube or a J tube or whatever kind of tube you have whenever bowel sounds are present, which is usually 24 hours after placement.
Yeah.
So until then, you're not going to feed them through their tube.
Did we talk about NG tubes?
We do not have a card about NG tubes.
Okay, well, you can.
There is such a thing called an NG tube.
And you want to make sure you mark where it is, like how far in it is, because if it comes out a little bit, you'd want to know that it's not all the way in their stomach any longer. So say it's in however many centimeters. Just make sure you write that down. Mm-hmm. Also, NG tubes have more of a risk for aspiration because they can
become dislodged.
Yeah.
It's just, they're not as good as tubes.
But they're less invasive because you don't actually have to have surgery to get it put in.
And probably less of risk of infection too.
Yeah. There's no scars or anything.
No going through the abdomen.
Yeah.
And then when you're going to administer tube feeding, you want to have the patient sitting or lying with the head of the bed 30 to 45 degrees up.
Mm-hmm. And you want the head of the bed to remain elevated for half an hour to an hour after feeding.
Yes.
Unless they're getting a continuous feed, then
I'm not really sure.
Look that up. But
and you should irrigate your tube with water before and after administration because you want to flush it out. You don't want any junk in there.
And you never know who didn't irrigate before you and what you could be.
Yeah.
Just hanging around in the tube.
Exactly. You can't trust your fellow nurses. And aspiration is not as much of an issue if you have a PEG or a J tube, which I think we've already mentioned. And you need to check your placement. So you can aspirate the stomach contents to make sure that they are acidic enough. They need to be lower than 5.
Yes, 5 or lower.
5 or lower. Yes.
It indicates stomach contents.
So you're going to do that before and after meals.
So it might be obvious that you are aspirating stomach contents because you're not going to be aspirating esophageal contents or anything.
Or blood would be bad. It could happen. I'm not saying it wouldn't, but that would be a no-no. And then another way you can check the placement.
Oh, is when you aspirate for contents, you want to see how much is left in the residual left in the stomach.
Right. Okay.
And for a volume greater than 150 mLs, you want to hold the feeding for an hour and then recheck. Mm-hmm. If it's more than 110% of the hourly rate of the pump, you want to hold the feeding.
And the feeding should be at room or body temperature.